Hello, my name is Zachary Brooks with UGenome. We make genomic medicine personal and accessible for everyone. Today I'm here with Marisela Rodriguez, who is the Director of Longevity for UGenome. Today she's going to be talking about DNA2Health, UGenome's new set of consumer products, health products, making it accessible. So with that, Marisela, take it away.
Absolutely. Thank you, Zach. Today I'll be going over what DNA2Health is. I'll be covering our 5 health pillars, and lastly, talk to you through about how you can go from your DNA to daily decisions. So, with DNA2Health, you can unlock deeper health insights from your DNA. This is what makes our direct-to-consumer product truly personal. And so we provide you with wellness reports that come with actionable recommendations. And so with that, we have 5 different categories that you can choose from, as you see listed here: mind, body, reproductive, longevity, and as well as advanced reports that I will dive into the details of later on in the presentation. So, the future of personalized medicine, that future is now. Today, you have direct access to personalized genetic information and personal health considerations that are rooted in your DNA. Today, you can understand how genetics can inform your decisions around wellness, prevention, and overall long-term care. UGenome supports our healthier informed choices across a lifetime. We support deeper self-awareness and we advocate for a quality health span. So today, genomic medicine is impactful and empowering to you. Very quickly, I'll go over what this is not and what this is. It is not a diagnosis or a medical treatment, and certainly not a replacement for your physician. But this will provide insights into what you may want to test in the future. It will be educational and evidence informed. And as I've been saying, truly, truly personalized. So to go into a little bit more further details of our 5 health pillars, in the mind reports or mind category reports, think of this as how you will think and rest and age, including your brain health and sleep. Under our body category, this is how you feel and function. We cover cardiovascular, metabolic, bone health, as well as inflammation and autoimmunity with skin and beauty and detox reports. Under our reproductive, this is how your biology drives life stages. So here we include perimenopause, female and male fertility, as well as reproductive health reports. In our advanced reports, this is our medical grade genetic blueprint reports of including cancer risk screening, functional DNA reports that go into 2 other categories. And the 300 and 100 differences there are the length of reports and details that you will find within them. Within our longevity categories, this is how you can begin to optimize. So we include diet, nutrition, reports, recommendations on healthy aging. Here we have your hormone health and precision wellness. So I'm going to do a little bit of a deep dive into our longevity reports and show you what those look like. Um, Here you will get a summary overview of your results with recommendations. The bulk of the report will have your results and details, and of course, recommendations at the very end that will make all of this information actionable. And you will have indicator icons, as you can see here on the right, including less likely, your typical likelihood, more likely, and more likely. The differences between those are the statistical significances within your DNA, and I will show you how that or what that will look like. So for example, here, under the overview of your results, Here we can see our icons of where you are less likely, your typical likelihood. And as you can see, we have a very one that stands out that is more likely here, artery hardening. So we're going to go ahead and tackle that one. Um, Deeper into your report, you will see this is from a sample client. So you are more likely, this sample client will have more likelihood of having artery hardening. And so this is perhaps something they were not aware of. Um, and they can do a deeper dive into what they can take action on. So by understanding these genetic factors and contributing that can contribute to issues, you can be more proactive and you will be empowered to monitor your health and seek early interventions. So here we have the artery hardening, a more detailed report. It shows you that based on 51,588 genetic variants that we look at, our sample client falls within the 95th percentile. And so here on the right, we have the SNPs, the genes, the genotypes that you can further discuss with your doctor if you would like to pursue any types of further testing. And so you will have directly that information that you can work with. And so how this can now turn into something actionable, and how this can help. We will give you within the reports literature that you can go back to and reference. As you can see here, we point to olive oil and the use of olive oil in cooking and how this can reduce oxidative stress and inflammation markers. And then we also have recommendations for supplements that you can take for this predisposition of artery hardening, such as these plant sterols and stanols. We go as far and specific to say that you can start with a 300 milligram dose or simply begin incorporating foods more intentionally, such as margarines, orange juice, and yogurt drinks. So that's a bit of an overview of what a longevity report can contain and how you can dive deeper into these insights and empower yourself into your health. And so, points to keep in mind as you review your results. These data, they define relative risk, and an increased risk does not mean cause and effect. So, this information is provided as a way for you to identify areas of your health that you may want to pay closer attention to based on your genetics. And as I mentioned earlier, this certainly does not replace your physician. So, use this knowledge and discuss it with your doctor. Here, you can consider adding blood tests to assess if your levels are within the normal range. You can definitely opt for preventative tests to screen for conditions and, of course, optimize your lifestyle and factors that can counteract any information that you find within your reports of increased risk. So, data privacy and security concerns, we definitely want to be on top of this and share with you that we do store your DNA data, but it's encrypted, it's anonymized, and it's completely separate from personal identifiers. We do not sell or share in any way your genetic data with third parties, and we allow you to delete your data at any time. So our clients will have direct access to making that choice. We do follow HIPAA and GDPR policies regarding your data. And if you have any further questions on how we do this, please reach out to us. We're also actively working towards national AI safety certifications. And so, with that, if you'd like to learn more and participate and experience what it means to have a DNA to Health report, you can visit shop.dna2health.com.
Marisela, thank you so much. So we'll keep this up on the screen, shop www.dna2health.com. We'll also, in the post, you're going to see a bunch of links to connect with UGenome and see if we can help you in some very specific way. Again, Zach Brooks from UGenome. We make genomic medicine personal and accessible for everyone. Marisela, thank you so much.
Of course.